Hey everybody, my name is Matt Estrad and I want to make this quick video about COVID-19 and how it's impacting senior living facilities around the country. Today is Sunday, March 22nd, so I'll be providing information that is up to date for today and some resources on how to follow this as it progresses. So I got this idea to make an update because this past Tuesday I was leading an online caregiver support group, and one of the clients on there has a mother who's in a memory care facility, and of course is impacted by COVID-19. And she was talking about how stressful it is that she's having trouble communicating with her mom. She's not able to make sure she's getting the proper care that she needs to, because she's used to going and checking on her, sometimes changing her, sometimes feeding her. So of course she's very stressed out. So I thought an update might be in order to talk about everybody who's involved, because there are many people that are involved, from the residents to the administrators. So we'll talk about each of those groups and how they're being impacted in this brief video. All right, so I'm going to go to this presentation. All right, so the lockdown is concerning, that we're talking about, is concerning nursing facilities, assisted living facilities, memory care, and retirement care communities. So all right, so who's being impacted? So it's several people, like I talked about. Of course, you have the residents who are living in the facilities. You have the family members that are not living there, but they're impacted. And then you have the other groups that are on site as well, so the staff members as well as the nursing home administrators. So where can you find updates? CMS.gov is a great place to look. So CMS is the Centers for Medicare and Medicaid Services, and they are over the nursing facilities. So I'll get to a memo that they issued on March 13th in a moment. Now, as far as the assisted living facilities, memory care units, other facilities like this that are not under the auspices of CMS are going to fall under the control and regulation of the state. So you want to look for your state Department of Health and Hospitals, or whatever it's called in your state. But what we have found in reviewing the documents and talking to administrators, that the memory care facilities and the assisted living facilities, they're basically following the CMS guidelines at a minimum. So they may have more regulations, but at a minimum, they're looking at CMS. All right, so here is that memo. It's a 6-page memo that came out on March 13th, and I'm not expecting to be able to look at this, but I'll provide in the resources a way to get your hands on this. I do have some highlights. So all the red font is theirs. These are updates since the last version, and I've highlighted some things that I want to go over very, very quickly. So one is facilities should restrict visitation to all visitors and non-essential healthcare personnel unless there are certain compassionate care situations such as end of life. So if that is in the case, and it takes working with your physician and their medical director to determine if it's an end of life situation, you should be allowed to enter the property, the facility, under certain circumstances like this. And then, but also be expected that you're going to have to put on protective, the PPE, protective equipment. You're going to have to, they'll check you to make sure that you're not showing symptoms. They'll check you for a fever, etc. So they'll have some procedures that are also outlined in here as guidance to the facilities, but just please be aware of that. Some other things, they've canceled communal dining, so they're not eating in a dining area. Meals are going to be delivered to their rooms. All group activities, all the fun things that keep them engaged, those are now going to be canceled as we see them. But they should live on. They should find a way. The facility should find a way to engage the residents and the elders in some kind of way, even though these groups have been canceled. So we'll talk more about that on another video. In lieu of visits, and I have a couple of things highlighted here, facilities should consider alternative means of communication for people who would otherwise be visiting. So that's FaceTime, that's Skype, that's Zoom, Google Hangouts. So the administrators are going to be pressed to find ways to allow for communication between loved ones. So to the extent that they can do that, that's going to be providing good service, essential service. Also, they're recommending the creation of a listserv of communication, so emails to families to let them know what's going on. Possibly assignment of staff as a primary contact for families when the facility is receiving calls. So this is not a requirement, but this is something that CMS is suggesting. And then offering a phone line with a voice recording that has updates at a certain time of the day. Let's see, when visitation is necessary and allowable, such as the end-of-life situation we talked about, facilities should make efforts to allow for safe visitation, and then they'll go through the safe visitation procedures when that's the case. Residents should still have the right to access the Ombudsman program. That is the person in each state. They and their staff, they receive complaints, possible violations of rights, so they still should have access to that, even in this very confusing state that we're in. And there's a bunch of other links and suggestions. So I just went over the highlights, but I'll make that available so you can find that, and I'll even provide so that as this memo is updated in the future, you'll be able to find that one. All right, so we talked about briefly about these groups that are impacted. So how are they impacted? Well, the residents, they're likely going to be stressed and extra confused, even if they don't have dementia, because they're at risk of COVID-19. They're isolated to their rooms, so they're not able to interact if that's something that they are used to enjoying. And they're also more subject to these three plagues of institutionalism, and that's boredom, loneliness, and helplessness. These are the words of Dr. Bill Thomas and the Eden Alternative, who have some great webinars on creative ways to combat these plagues of institution, which, by the way, I will say these could happen in a home also. Then when we talk about family members, I mentioned the person that I spoke with last Tuesday. So when they're not able to communicate with their loved one, that can be very stressful. They're also, of course, going to be worried about their loved one and possibly being at risk of contracting COVID-19. So we all want to be sensitive. All four of these parties, we want to have a dialogue and to be sensitive about what's going on in each other's world. Let me back up to the residents for a moment. We need to include them as much as we can in what's going on. So they're a great source of things, of alternatives to the group activity. So if we can't meet as a group, what else can we do? Also, as far as the communication, let's be engaging our residents, our clients, in how they can communicate with their family. So some of them are tech savvy. So let's not just think that they don't know how to use technology. Let's go to them for ideas and include them in as much as we can. Then we have the staff, and these are the CNAs, these are the nurses, these are the ones that are helping with bathing and feeding, etc. So we need to understand that they're under a lot of stress already. They're not able to see their family as much as they would like to, as they're probably most likely on lockdown as well, and possibly going to other facilities doing the same thing. They're working long hours, and they're at risk for COVID-19 as well. And then when we look finally at the administrators, they're experiencing those stresses that the staff are, plus even more since they have more under their charge. So they're looking to improve and increase communication. So hopefully they're looking at different technologies and creative ways to find out how they're going to facilitate communication. They're responsible for their staff as well as their residents. So they're concerned about the morale, keeping everybody positive, so that the staff members do well and they will take care of the residents that are in the facility. And finally, maintaining quality of care, and that goes back to the morale that I mentioned before. So lots of things going on. I'll have more videos to update as we have more information, as we have more ideas of engaging elders. I'm going to have some resources that are available. We'll have more CMS memos as they come out with further directions. Keep in touch with your state Department of Health and hospitals on what they're doing. But again, they're going to be looking largely to the CMS regulations to protect themselves, to protect the residents. I have other resources at dementiarosary.com. The Peace with Dementia Rosary is a book that I wrote in 2019, and it takes families through a spiritual as well as a practical guide for dementia. I welcome all comments to this. Do you have ideas? Are you working in a facility right now? Are you a family member of someone that's a resident in any of these facilities? Please leave comments wherever you see this, in Facebook, on the website, on YouTube. I welcome y'all's comments and additional questions. I'm in the process of reaching out to administrators and staff members so that I can get their take, especially on how to engage loved ones in this very trying time that will pass. Please know of my prayers for everybody that's involved, from staff members, family members, residents, administrators. We want you all to do well. If I can support you in any way, please reach out to me. Thank you, and God bless.